Morning all. My name's Mohammed Ali and I'm also known as Junaid, and I'm based at Woodfield Road and I work as a school health technician. Previous to the job role that I do now, I worked as a student welfare officer in a London school for 7 years, and previous to that I've worked with the LGBT community with the young youths. So today I'm going to talk to you about child sexual exploitation and sexual exploitation of children and young people under the age of 18 is in regards to situations where children and young people get into relationships where young people receive food, accommodation, drugs, alcohol, cigarettes, affection, in a result of them exchanging sexual acts or activities, being involved in that. So child sexual exploitation can occur through the use of technology without the child's immediate gain or recognition. For example, being persuaded to post sexual images on the internet by using the mobile phone or other technology, the iPad. So child sexual exploitation has only come to the forefront of the public eye after serious case reviews as the Rotherham, Oxford, Bradford and Rochdale cases, which I'm sure all of you have heard of on the media or in the newspapers or other social media sites. My project is to develop Band 4 school health technicians into delivering small workshops in secondary schools, primarily working with Year 10s and Year 11 students. My project will basically raise the awareness of child exploitation with the young children. So, the rises in cases of child sexual exploitation in inner London boroughs have risen in reference to the Bernardo study. The service has worked with 1,940 children and young people who have been sexually exploited. Children at risk of child exploitation are some of the most vulnerable in our society. Child sexual exploitation can affect any children of any age, background, race, religion, culture, sexuality or family status. Bernardo's has worked with 126 children between 10 to 13 who have been subject to sexual exploitation. My project will be to hold discussion-based workshops, which will be divided into 3 miniature workshops. The first, which will be based on looking at relationships. So this workshop will look at what is a healthy relationship. This would give our young people an understanding of what relationships are about. It also would give an understanding about the law and what the law says about having relationships with older partners. So the second workshop will look at what is sexual exploitation. There is so much training out there for us professionals, but however, there's not enough training out there for our young people in how to stay safe. So the second workshop will look at what is sexual exploitation, and this would give our young people the understanding of that. The third workshop will look at where they can go for help or advice. So this workshop will look at all of the different agencies that are in place in the local area to them, so where they could go and receive that help and support if they need it. The materials and the resources that will be used for the workshops will be in line with CEOP, which is the Child Exploitation and Online Protection Centre. The workshops will be designed to be split into small groups, so it will be mainly discussion-based. After the 3 workshops have been completed, an evaluation questionnaire will be presented to our young people to see if we have met the needs of their requirement. The workshops will enable the Band 4s to stretch themselves into the health promotion sector. It also benefits the schools as it's in partnership with the Child Protection, and it's also in line with the Every Child Matters, so it will help with that. It also would benefit CLCH, as school nursing is basically predominantly funded through patient face-to-face contact, and this is patient face-to-face contact. If this pilot is successful, I would like to hold other workshops as well in secondary schools, working and looking at situations of domestic abuse, body image in the media, sexual orientation, stereotypes, bullying and intimidation, feeling high, which is drugs and alcohol, and also love and playing safe, which is sex and relationships, and also to do with terrorism and radicalisation, which is in the forefront of the media at the moment. Do we have any questions? Yeah.
These workshops, can anyone go to it in the health profession?
It will be basically for Band 4s and Band 5 nurses to go out into secondary schools across London to deliver the sessions, workshops.
And it will just be aged 10 to 13?
I would like to start with year 10 and year 11s, which are actually older children, because they're going to be going off during the summer holidays, and that's when things tend to occur. But then I would like to work it across the whole entire school and also primary school, if it's possible. Yeah.
Have you started already? When are you about to start?
When am I?
Have you started this program already?
No, I haven't, but I'm on the process of talking with my team about it. So, any more questions? No?
You know, you say you're going to be taken to year 10 and 11.
Mhm.
You know, with the parents being involved with what's going on, and you know, because some of the parents won't be happy about, you know, their children listening to all this information. So how are you going to go about it?
I would definitely hold like coffee mornings in the morning to explain to parents what the actual program is about. This would give them enough information on what type of work we're trying to do. It's actually benefiting their children, because at the moment technology is everywhere and that's what they're using. So it's really important just to educate the parents and empower them as well, to let them know what's happening as well. Yeah. Oh.
Would you be happy for student nurses to come along?
Yeah, definitely. I think it's really important for them to actually come in and get involved so they know what's happening in our society. Yeah. That's it.
Let's thank
Great.